Hello, Dr. O'Shaughnessy.
Right.
I'm Donna Myers, and I've been working with the management here at the clinic to explore the potential for team-based care, interprofessional teams. Have you heard a little bit about that, or tell me what you know?
Uh, I have heard a little bit about it. I know yeah, more people are contributing in the patient's care. Other providers, other skilled professionals.
So, a little bit broader than what you have right now. Help me know a little bit about how you take care of your patients right now, because I know you're doing an excellent job. You have a number of patients that come back to see you, whether it's once a year or once a month or however often. You've
Mm-hmm.
got a good following. So tell me
Mm-hmm.
how you do it now.
Um, I I have a good staff. We work together, we build a rapport. They anticipate my needs. I have a good front office, back office, nurses.
So you've already got a team,
Mm-hmm.
in essence, and they support you front office, which means registration, back office, which means rooming the patient and preparing for your visit.
Mm-hmm.
Help me know a little bit more about what they contribute to you to
Mm-hmm.
manage that patient.
Um, they collect information and do vitals and document, um, collect some of the questions that the patient may have that they want to have addressed during the visit, things like that.
So they help you by preparing,
Mm-hmm.
collecting information, data, information you'll use as you take care of the patient.
Mm-hmm.
Do they do anything with the patient after you've seen the patient?
Um, Record keeping, things like that.
Does
Following up,
following?
following up with the patients.
Okay, okay. So like if they get referrals or
Mm-hmm.
they're trying to arrange those kinds of things.
Mm-hmm.
Okay. So they kind of open that visit for you and
Close the visit.
help
Mm-hmm.
you close the visit.
Mm-hmm.
Does that aid you in any way in terms of seeing patients, the number of patients you see?
Yes,
How's
it
that?
allows me to see more.
Okay, because you already have
Mm-hmm.
folks that are helping you to
Mm-hmm.
make it a little bit more efficient and timely.
Mm-hmm.
Uh, what you've described for me so far is a good approach where you trust one another, where you know what to anticipate each other's doing.
Mm-hmm.
Um, if I could ask you anything that you'd like to change about how things are going right now, because they're going well,
Mm-hmm.
right? What would that be?
I don't have a lot of time with my patients. Um, and I see, because I don't have a lot of time to spend with them, I end up seeing some of them more often.
Okay, so time is of the essence, in other
Mm-hmm.
words.
Mm-hmm.
You don't have enough time with the patients, and then you have to spend more time, I guess, repeated visits. Is that safe to
Right.
say? Okay.
Mm-hmm. Which takes time away. It's
Yeah.
kind of like a cycle. Mm-hmm.
Yes, it is like a cycle, isn't it?
Mm-hmm.
It's like the cycle of seeing patients where
Mm-hmm.
when they have more needs, you can't address all the needs. That takes your time. Then you have to schedule more time,
Mm-hmm.
and then it makes less time available to see other patients.
Mm-hmm.
So you're a little bit like the mouse in the wheel, and
Mm-hmm.
it just keeps churning.
Mm-hmm.
Okay, let's kind of leave that analogy for just a bit, and let me talk a little bit more about what you understand that the team can do.
Mm-hmm.
Have you any experience with any other professionals?
Yes, other professionals that are involved in their care, maybe specialists that they see,
Sure.
um, or pharmacists.
Oh, okay. So other specialists that they see.
Mm-hmm.
Um, how do you use other specialists, and how do you choose to use them?
We basically share information in regards to their care, opinions about treatment, and things like that.
How do you choose them? How do you make these choices about what specialists, or is it just kind of random?
Well, it's somebody who's already involved in their care, or it's somebody that I have a rapport with and a trusted relationship with.
So, as often as you can, you choose who those consultants or those specialists are
Mm-hmm.
because you know and value what they do,
Mm-hmm.
and you can trust that they're going to give you feedback that's appropriate. Is
Right.
that
Mm-hmm.
okay? Okay. You mentioned the pharmacist. Tell me about your
Mm-hmm.
relationship with the pharmacist.
Um, with the pharmacist, I can consult them about different medications, and if they reach out to me in regards to medications and interactions and things like that.
So already you can ask them questions, they'll give you feedback that you find helpful, or they might even make suggestions to you so that you can decide if it's appropriate or not. So you have a collaborative relationship already with pharmacists. That's good because maybe that's the way that we begin to look at um, expanding your team. Perhaps there's more opportunity to use the pharmacist. I do want to confirm, though, that whatever you engage in doing is your choice. You are the clinician, you are the physician in charge of the patient's care, and you assume that responsibility. So it's really your decision about what happens next. All I can do is try to support you, try to be collaborative, try to give you information, anything that might be helpful. So I just wanted to reaffirm that that's where we are. You make decisions. I'd like to give you a little bit more information about change, if you're willing. Is that okay?
Sure.
Okay. When we talk to people about making changes, we realize that there are stages of change. There's pre-contemplation, there's contemplation, there's preparation for change, there's you take action, and then you try to maintain whatever change you've undertaken. I hope it's okay with you if I tell you where I think you are right now in terms of these stages of change. I think you're a little bit beyond pre-contemplative because I think you know a little bit about interprofessional teams. I think you're kind of at contemplative, which means, oh, yeah, I thought about it a little bit, got some questions, I'm not really sure. So a little bit ambivalent, not quite ready to even think about preparing to make a change. What could happen that would help you move to that next phase of preparation? What could happen?
Maybe learning a little bit more about it. I can see how it would be beneficial. My fear is the amount of time it would take from my day to coordinate all of that and learn more about it.
Okay. May I give you a little more information then about what I think I heard you say and clarify that? Um, you you are thinking about it, but to be able to prepare, you'd like to have a little bit more confirmation that one, it's not going to take more of your time, and two, that it's actually going to improve the care that you provide your patients. Is that a fair statement?
Yes.
Okay. We've learned with the use of an interprofessional team that it does maximize the all of the people that are providing care. It maximizes the time and the efforts that they expend with the patient. The patient values it. The patient feels more confident. The patient responds and evaluates their care as high quality. So we know that there's some potential for good outcomes in this. If you could see the pros of this, what would they be?
Better patient care, more of a coordinated effort towards their care, and possibly being able to manage my time a little bit better through the day and having additional time with other patients, whereas I normally wouldn't.
Okay, so some pros might be better able to manage, better able to manage your time, spend time appropriately with each of your patients, and potential for even better quality care. What are the cons?
Losing time in my day because I'm spending time trying to coordinate care.
So the time that it takes to interact with other members of the team may drain you of time instead of making more time available. So you've got a lot of ambivalence about kind of your key issue that you've said from the beginning, time. All right. I'd like to offer a possible solution, if you're willing, to consider it. Okay? So how confident are you that perhaps you can make a change?
I'm not really sure.
On a scale of 1 to 10, where would you think you'd fall?
Maybe a 6 or 7.
Maybe a 6 or 7.
Mm-hmm.
Tell me why you weren't a 4 or a 5.
I can see how it would be beneficial.
Okay, so you can see some promise here.
Mm-hmm.
It has some importance. It
Mm-hmm.
has some value. Okay, what would make you for sure a 7 or an 8?
Maybe with some sampling or kind of testing out and see if it benefits my day at all.
So you want to see proof.
Mm-hmm.
Fair?
Yes.
Okay. I'd like to help you. Are you willing to go into that preparation stage where we talk about maybe how to test this out?
Sure.
Okay. I have an idea. May I offer it?
Sure.
You mentioned the pharmacist. The pharmacist is the team member that you've already established a relationship with. You have some interaction already where you share that care of the patient. Maybe we could expand that a bit. Let's say, looking ahead at your schedule every day, 1 to 2 patients per day where the pharmacist could actually see the patient before you see the patient, reconcile their medications, maybe make some changes in their medications, document it so that you actually know what the pharmacist has evaluated and planned prior to you seeing the patient so that you can reaffirm that as you visit with the patient. What do you think of that?
I think that would be okay.
Okay. Do you see any advantages to doing it that way in terms of taking some action?
Yes, I already work with a pharmacist somewhat, so yeah, I can
Okay,
see
so
how
it's
that.
just a little bit expanding what the pharmacist has been doing already. We're just giving the pharmacist a little bit more responsibility. Okay. Um, how long do you think this would be a good trial?
Mm-hmm. Maybe 30 days.
30 days. I kind of agree. I think that's, 5 days a week, seeing 2 patients a day. Surely that would give you kind of some feedback, a return on your time investment about, is this going to be useful to you? Is the end result going to be a benefit to you and to the patient? How would you feel about me kind of checking in with you weekly? And then we really, really spend time evaluating it at the end of the 30 days. What do you think?
Sure.
Okay. So is next week too soon, or when would you like to start?
Next week would be fine.
Okay, let's meet with the pharmacist and we can start making the preparations to take action.
Okay.
Thank you.
Thank you.